Hello everyone, and welcome to this LymphaTouch webinar. Today you will learn how to apply LymphaTouch medical device as a part of manual treatments in cancer rehabilitation. My name is Tina Smeds. I work as Sales and Marketing Manager at LymphaTouch. Previously, I've been working as a clinical specialist for several years. My background is in physiotherapy, and I'm also a certified lymphedema therapist. Again, welcome all, and I hope you enjoy this webinar. In this webinar, we'll first go through the introduction to the topic itself. We will cover LymphaTouch product, its operating principle and treatment areas. We'll then continue with some case examples and the actual demonstration on how the device works. We'll also see our latest study results, and in the end, we will have a small recap about the webinar. Let's start with a brief introduction to the topic. I'm sure that many of you as healthcare professionals have been part of a treatment chain of cancer patients and survivors. As we know, the cancer itself is many times a huge shock for the patients. We also know that cancer treatment can cause many complications and side effects that patients need to cope with after treatments. As healthcare professionals, we want to help our patients with these uncomfortable and painful side effects. Here is a short list just to mention a few of the symptoms and conditions that cancer survivors many times face with. For example, lymphedema, soft tissue restrictions, scar tissue buildup after operations that can cause many types of discomforts for the patients, and they are also affecting everyday living. We need to try to help these individuals and utilize our expertise and available methods and technologies as much as possible. To understand how LymphaTouch works in the rehabilitation of cancer patients, it's important to understand the basics about the lymphatic flow. I'm sure that many of you are very familiar with this, but a brief recap is usually beneficial for all of us. The main function of the lymphatic system is to remove the excess fluids from body tissues. It also plays an important role in the immune system and absorption of fatty acids. It helps to keep the body fluid levels in balance and defends the body against infections. The circulation of the lymph starts in the interstitial level. Interstitial fluid diffuses from the blood capillaries to the interstitial spaces. From there, lymphatic capillaries absorb the fluid, and from stronger and thicker lymphatic vessels, that transfers the fluid towards lymph nodes. Major lymph node groups are located in stomach, axillary, and inguinal areas. However, there are also elsewhere in the body, for example, in head and neck, elbow and knee areas. Lymph nodes play an important role in cleaning and filtering fluid. Lymph fluid moves forward in the lymphatic system to the ducts, either the thoracic duct or right lymphatic duct, and eventually back to blood circulation from the subclavian vein. With LymphaTouch, we aim to enhance lymphatic flow, and this way we reduce swelling, for example, with lymphedema patients. With LymphaTouch, we activate parts of the lymphatic system and guide the lymph from distal to proximal according to the direction of the lymphatic flow. If the fluid is unable to move forward in the tissue, it starts to swell with fluid. This condition is called lymphedema. Lymphedema can occur everywhere in the body, just like lymphatic tissue. But also commonly, it occurs in arms or legs when parts of the lymphatic system are blocked, damaged, or removed by surgery. Lymphedema can also be a primary condition, but in case of cancer patients, it's usually a secondary disease. For example, in cancer surgeries, the lymph nodes that are close to the tumor area are often removed or radiated. The removed or damaged lymph nodes might predispose the body for lymphatic swelling. Secondary lymphedema can also occur after surgeries, traumas, or infections in other patient population as well. It is usually permanent of a disease that causes many kind of discomfort and functional issues to the patient. Nowadays, there are several efficient methods to manage swelling and functional problems caused by lymphedema. Comprehensive care is the key word. Lymphedema management consists of two important phases. The first one is the intensive phase, and second one is the self-care phase. Both phases are essential for successful care. They consist more or less the same treatment methods. During intensive phase, patients receive education and treatments of lymphedema from the healthcare professionals. This is the phase where we, healthcare professionals, play a very important role. In self-care, patients will utilize all the information and perform the management by themselves with the help of clinicians. Complete decongestive therapy, CDT, consists of a combination of different treatments for lymphedema. CDT includes manual lymph drainage, which is shortened as MLD, compression therapy, decongestive exercises, and skin care. CDT has been considered as standard care for lymphedema treatments. MLD is a type of massage performed by a certified lymphedema therapist. The aim of MLD is to enhance lymphatic drainage and reduce swelling of the treated area. MLD techniques traditionally follow gentle pumping and circular movement patterns with a low pressure combined with a resting phase. Also, breathing techniques are commonly combined with MLD. It is also important that the patient learns MLD techniques by herself. The therapist guides the patient and teaches how to perform self-MLD at home to manage and control swelling. Compression therapy is usually applied after MLD to maintain the reached results. Compression is considered as the cornerstone of lymphedema management, and it mainly works on the collectors and tissue pressure to prevent further swelling. There are different types of compression therapies, such as compression bandages, garments, and stockings. It is very important to be physically active to keep our lymphatic system going. There are also certain types of specific exercises that lymphedema patients perform in order to reduce swelling. Ideally, the exercises should be performed after the MLD session. In addition to these specific exercises, for example, stretching, swimming, water aerobics, and walking are great forms of physical activities. It is also extremely important to take care of good skin and nail conditions. Lymphedema patients are many times prone to infections due to the problems in the lymphatic system. It is important to keep skin hydrated and smooth with special lotions and be careful not to damage the skin in the first place, and to avoid damages such as strings, bruises, and scratches. Good lymphedema management is a combination of all of these treatments, and the best way to achieve this is in good collaboration between the healthcare professional and the patients and their families. LymphaTouch is a medical device that is designed to reduce swelling and pain with negative pressure and mechanical vibration. It is CE certified and FDA approved medical device. Let's watch this video short. It will demonstrate the simple operating principle of LymphaTouch. As we saw from the video, LymphaTouch creates controlled negative pressure and that expands and stretches the skin and tissue vertically. This activates lymphatic capillary network by pulling anchoring filaments and opening endothelial holes, which helps the lymph to move back into the lymphatic capillary network. LymphaTouch helps to reduce swelling, pain, fascial restrictions by pulling the tissue and by creating more space for the lymphatic and blood circulation. LymphaTouch works as a supplementary tool for manual treatments in therapy. In addition to negative pressure, the device also creates mechanical high-frequency vibration that can be very useful when we want to soften up the tissue, such as fibrotic or scar tissue. We will come back to this later in the webinar. The results can be assessed easily at the clinic before and after the treatment. Good examples of measurements are VAS pain ratings, changes in the circumference, and also range of motion of the treated area. There are interesting ultrasound videos available at our Vimeo channel to show you more in detail what happens in the tissue during LymphaTouch treatment. Let's look at a few of the videos next. In this video, you can see what happens when we activate the axillary areas with LymphaTouch. This video is from a 29-year-old healthy female. They were using 80 millimeters of mercury negative pressure with pulsation. You can see the movement of axillary lymph nodes and fascia towards LymphaTouch during the work phase, and again recovery during rest phase. We are able to see movement in depth of 3 centimeters and actually even deeper. In the second video, you can see the inguinal lymph node of a 60-year-old male. In this video, they used 120 millimeters of mercury with the pulsation setting. Notable is that LymphaTouch is activating the lymph node very well by changing the form of the lymph node. Also, we can efficiently mobilize both superficial and deeper fascia with negative pressure. In this video, especially interesting is the cross-fascial movement of the layers when the deeper fascia moves to the opposite direction that superficial fascia during the work phase. The third video shows us how negative pressure combined with mechanical vibration affects even the depth of 5 centimeters. They were using 120 millimeters of mercury negative pressure and 60 Hz of vibration with the stationary technique. Doppler setting shows us the color inside of the square, which indicates the movement of the tissue during the work phase of negative pressure and vibration. With vibration, we can work with the adhesions in deeper levels, as you can see from this video. Next, we will continue with the treatment areas and case examples on how to apply LymphaTouch, especially with the cancer patients. LymphaTouch is widely used in different segments and patient populations. However, the indications for use are mainly the same in all of the segments, but there are also some specific indications. The main applications of LymphaTouch treatments are treating swelling and edema in different conditions, but also promoting faster recovery for patients in rehabilitation, orthopedics, sports, and aesthetic medicine. LymphaTouch treatment can be done to help reduce swelling and pain in lymphedema patients, but also for acute injuries and for pre- and post-op patients. It can also help in bruising and to support the overall rehabilitation process. LymphaTouch can also be used to promote the healing process of fresh scars, but also to help loosen up adhesions and soften up the tissue in older scars. Applying LymphaTouch negative pressure around the joint area is an efficient way of reaching joint interspaces and to improve range of motion in rehabilitation of musculoskeletal disorders and sports athletes. The negative pressure is also an excellent way of pre-activating the tissue before applying other manual techniques. The question is, but how and why to apply LymphaTouch treatment for the cancer patients? LymphaTouch can be used as part of manual lymphatic drainage with cancer patients. It works well as a supplementing tool for lymphedema treatments. In manual treatments, we usually apply positive pressure to the tissue and sometimes Even a light pressure might feel uncomfortable for the patients, especially with lymphedema. Patients many times tolerate negative pressure very well, and it helps to get the concrete results faster than the manual treatments alone. Also, using supplementary tools saves the hands of the therapist, since manual treatments can be hard work, especially in cases of treating scar tissue fibrosis or severe lymphedema patients. As you know, you've learned that the device can be used as part of rehabilitation. I will more focus on the indication, especially with cancer patients. LymphaTouch works as part of MLD treatments. As I mentioned previously, the main application is to improve fluid reduction and reduce swelling by following exactly the same lymphatic pathways as in manual lymphatic drainage. It assists with treating lymphedema, and the therapist can choose to do the entire treatment device-assisted or to do parts of the treatment manually. LymphaTouch can be used over the whole body from head to toe, and it really helps to reach the body parts that are many times hard to treat with hands, for example, around head and neck area, and also fingers and toes. LymphaTouch helps the therapist to work more efficiently with applying the third dimension to the manual treatment. The decompression created by the device helps to break up fibrotic tissue and deep swelling. Also, when combined with mechanical vibration, it works extremely well lifting and softening scar adhesions. Axillary web syndrome can be also sometimes hard to treat manually. So the device also helps with weakening the cords by pulling the skin in different directions. Myofascial decompression can be very efficient also with other soft tissue restrictions that can be a result of pain, surgeries, or lifestyle changes due to cancer, such as reduced physical activity. It is always good to combine other manual treatments, therapeutic exercises, and compression therapy that help to maintain the results of LymphaTouch treatment and to gain long-term results in the therapy. Now I will show you a few case examples of lymphedema treatment results. This case is a lower limb lymphedema before and after treatment. This has only been a 30-minute treatment, and as you can see, the swelling is much less after LymphaTouch treatment, especially around the ankle area. Here you can see how Women's Hospital is utilizing LymphaTouch in soft tissue mobilization after breast cancer surgery. This is a good example how you can release fascial restrictions and fibrotic and scar tissue. The patients many times report instant relief after the treatment, just like in this case. Next, I will show you how LymphaTouch works.
So today we will show you the LymphaTouch device and what parts are included. So we have the main unit itself. It works with battery, so that's very comfortable for use and also easy to bring along because it travels in a small bag like this. So you can easily take it to sports, or if you have home visits with your customers, that's great. The device itself can be placed on a roll stand, and that's very good for clinic use. And then we have a different assortment of treatment cups that can be used in the treatment. And then the cups are attached to a treatment handle that comes with the device itself. So also to remind you, we have different treatment instruction booklets that comes with the device, and you can find them in the bag. So we have one for lymphatic indications and one for more general rehabilitation and rehabilitation applications. So these booklets include a lot of information on how to apply, what treatment cups to use, when to wipe, what settings to use, just to help you get started. And the clinical proof book is also available on our website, so you can download it directly from lymphatouch.com. So please have a look at these documents. So you just push the button on the side of the LymphaTouch and turn on the device. It will automatically turn on. Next, the precautions and contraindications will be shown on the screen, so you have to confirm with them, and just to notify they are the same contraindications that are used for manual therapy. So next on the screen we can find a manual mode where you can find all the settings. So we just use the touch screen, and here you can find a pressure setting, you can find the vibration, pulsation, and also different combinations and variations of pulsation length and work and rest ratio. So it's very easy to use, so you can slide the arrow on the touch screen to change the pressure settings. So the lowest negative pressure value is 20 millimeters of mercury, and the highest negative pressure value that comes with the sport mode is 350 millimeters of mercury, so that's the maximum. And just to notify that the sport mode, sport upgrade, is an extra add. With basic settings we can work on the highest pressure level of 250 millimeters of mercury. The device itself comes with a fantastic add and setting of mechanical high frequency vibration. So that means that the negative pressure, so the suction, is on, and meanwhile it's lifting and pulling the tissue. We can use the high frequency vibration in a combination, and that can be set from 20 Hertz up to 90 Hertz, and it's purely mechanical, just to remember. So that's a great benefit because it doesn't contraindicate with metal parts in the body or pacemakers, but please pay attention still when treating those patients with the mechanical high frequency vibration. Other settings to be found here is also the continuous suction. That's a very nice setting to be used for fascial restrictions, scar treatments. So that basically means that the cup itself pulls the tissue as long as it stays in skin contact. We can also adjust the length of the pulse and the work and rest ratio of the overall working period. This symbol here indicates if the cup is in good skin contact. Yeah, so the green means that it's in good skin contact. If it comes with an orange color, it means that the skin contact is poor, and blue means that it's not in skin contact. So today we will demonstrate how LymphaTouch can be applied for lymphatic indications, treatments, and for cancer rehab. We have a lot of questions on how to apply and how this differs from the manual techniques. So firstly, to start up, the traditional manual lymphatic drainage is a technique that applies positive pressure, so we are more or less pushing the tissue down to help the lymphatic flow in that treated area. And with LymphaTouch we are working in an opposite direction, so we are creating a negative pressure and expanding the tissue. So you can really see inside of the cup how it pulls and how it expands. So to start up, we could activate the ducts and activate the lymphatic lymph node clusters. So we could work directly on top of the lymph node clusters with a stationary technique, and we will later on demonstrate how ultrasound imaging shows how the lymph nodes are affected and how they actually contract by the cause of negative pressure. So basically, if I would start up and start a treatment using LymphaTouch as part or to activate the lymph node clusters, ducts, I would use the stationary technique on top of those areas. So LymphaTouch could be used for tissue activation. We could gently just put the treatment cup on the skin, and it will automatically and immediately start generating negative pressure and pull the tissue. Now we have a basic setting of 80 millimeters of mercury and 2 seconds of pulsation. So we can basically pre-activate the treated area or area to be treated with the stationary technique to enhance and to improve the lymphatic flow in the area. As the area is pre-activated, we could then continue. I mean, we are using exactly the same lymphatic pathways as in manual work. So we are working from a proximal distal back to a proximal direction, and also redirecting the fluid into the healthy parts of the lymphatic system. So that doesn't differ in many ways. We know that a lot of joint restrictions may occur caused by radiation or immobility of the joint area. So we could also add a bit of traction or passive movement during the negative pressure to get a better range of motion of the joint area, and also to reach different joint angles, which is not possible by pressing manually. So the negative pressure helps us to expand the tissue. There might be some fascial restrictions, and they can occur within patients who have different type of lymphatic problems or diseases. So the fascial techniques that could be applied, or one technique that we tend to use is the lift and twist technique. So then we are kind of lifting and rotating the cup during the suction phase. This to help the fascial layers to move in different directions and to loosening up possible adhesions in the area. So we could work over those more local issues for several minutes. So this is a good example on how we can apply LymphaTouch only locally as well, if we do not want to conduct the whole therapy or whole lymphatic drainage device assisted. Now to show you how we can redirect fluid. So let's have an example where we have activated all the lymphatic lymph node clusters and the pathways, and now I will show you how to slide the cup on the skin. And if you wish, and if the skin is sensitive, fragile, we can apply some lotion or oil directly to the skin to help the cup move. And the sliding technique can be done with a pulsation setting or with a continuous negative pressure setting. So I will demonstrate and show you the different settings. So let's start with a pulsation setting. So basically now this technique and the setting with the pulsation could be used to help redirect the fluid once we have opened up and once we want to direct the fluid to the healthy parts of the lymphatics. So now I'm showing you the continuous suction and sliding. So this technique could also be used if we have fascial restrictions or if we want to help redirecting fluid. Please notify that the cup slides more easily if you don't push down the front of the cup. So give it a bit of ease and help the cup to slide. So this is very often also used within lymphedema patients. Next up, I will demonstrate you the vibration setting. So now we have a vibration setting of 90 Hertz, and it comes now with a combination with a pulsation. So this is very often used to help breaking up fibrotic tissue areas. So we could use a stationary technique. We can work with more lifting and twisting, so rotatory motion, or we could slide the cup over the area that is fibrotic. And this could be done to help mobilize and then help to soften up and break down the tissue so that it's easier to work manually later on. Quite often the vibration setting is also used with a continuous suction mode, so this means that as long as the cup stays in contact with the skin, it will create a suction and work the tissue area. So that's a very effective way of treating fibrotic tissue areas to help it break down, so that when it's time for compression and other treatment, skin care, the skin is in good condition and it has softened up compared to before. So next we will continue demonstrating how the smaller cups can be used, for example, for facial area. The smaller cups of LymphaTouch is a very effective way of treating areas that are difficult to treat by hands. And especially the 3 smallest cups are very good for head and neck treatments to reach different areas around the ear and the jaw, to help fascial restrictions, or if we have local scar treatments or local adhesions that we need to treat. So basically we can use the same technique, so we can slide the cup, we can use a stationary technique, and this smallest cup is absolutely amazing for reaching these really small specific parts that can be quite painful and difficult by hands. So this gives a nice alternative for treatment. So let's imagine that we have a local scarring here. So I will show you now how you could, for example, treat with a continuous negative pressure setting to help loosen up the scar adhesion and the restrictions, to help the lymphatic flow to the duct area. So that's one possible application and way of using the smaller cups within cancer rehab. So after treatment, remember to clean the cups. The cleaning is conducted with cleaning wipes, antiseptic wipes. The rubber ring can be removed from the 60 millimeters treatment cup. And also remember that the filters are disposable and they should be changed after every treatment. So just throw them away, take a wipe and clean the cup. We also recommend that you can have patient-specific cups for patients who comes for treatment for longer periods, or if they have, if they are in need of own cups. So keep that in mind. So take good care of your cups and clean them. Remember to change the cup frequently to keep good hygiene and to ensure a good treatment for your patients. And you can order cups from your local distributor, so please contact them in case of new delivery of cups.
Next, I will show you some of the latest study results. Treatment of breast cancer-related lymphedema with a negative pressure device, a pilot randomized study, was performed by a research team from University of California, San Francisco, and the results were shown in APTA Combined Sections meeting in Denver last February. Here you can see the poster presentation with all background information, methods, results, discussions, and conclusions. Here you can see what they did and also an updated abstract of the study, since the study team didn't finish data analysis by the time of APTA CSM submissions. So the purpose was to evaluate efficiency of treatment of chronic lymphedema using the LymphaTouch device. There were altogether 28 women who were post-active breast cancer treatment. and have had unilateral upper extremity lymphedema for over 1 year. They were randomized into a negative pressure device treatment group or a manual lymphatic drainage MLD control group. They compared LymphaTouch treatment to traditional MLD. All study subjects received 12 treatments over 5 to 6 weeks. They measured many different outcomes such as DASH questionnaire, bioimpedance, and lymph volume. At baseline, there were no significant differences between the groups. The LymphaTouch group demonstrated slightly greater improvement in LDEX volume and DASH scores compared to the MLD group. However, only the between groups difference in the change in LDEX reached statistical significance, favoring the LymphaTouch group. They concluded the treatment with LymphaTouch resulted in statistically significantly greater improvement in fluid reduction compared to MLD. Also, some greater improvement were observed in volume and self-reported function. Let's continue with the study results from Vanderbilt University. These two posters were shown in ILF International Lymphedema Framework last year in Chicago. In this one, they wanted to see if graded negative pressure has a place in complete decongestive treatment model, which is the standard care for lymphedema patients. As we learned previously, CDT includes compression, skin hygiene, exercise, and MLD, manual lymphatic drainage. The objective of this study was to test the hypothesis that mobilization of protein-enriched hardened tissue using graded negative pressure therapy in conjunction with CDT will improve patient-valued functional outcomes compared to CDT alone. They had 6 patients with advanced secondary arm or leg lymphedema who received sequentially CDT with and without LymphaTouch treatment. They evaluated outcome measures before and after the course of treatments with patient-specific functional scale. Results showed improvement with both therapies. However, the outcomes improved further when negative pressure was combined in the treatment. All 6 patients expressed greater improvement when graded negative pressure was utilized in their care. They felt their tissue softer, lymphedema easier to manage, and limb feeling lighter with less pain. They concluded that the inclusion of LymphaTouch with CDT provided further outcomes than CDT alone. The second poster in ILF 2019 was a case study of a 55-year-old lady with stage 3 lower limb lymphedema secondary to cervical adenocarcinoma. She had gone through a right pelvic and inguinal lymph node dissection and aggressive daily self-management for 17 years. They wanted to assess if CDT combined with negative pressure treatment would impact on the patient's expressed pain and quality of life, since CDT treatment alone had minimal effects on these outcomes in history. They conducted 10 weekly treatments with MLD combined with LymphaTouch treatment. As a result of the intervention, pain improved from VAS 4 out of 10 to 1 out of 10. Also, tissue mobility improved and hardness reduced. Patient-specific functional scale improved 4 points in a 10-point scale, ranking her importance in working, traveling, and photography, and lower extremity functional scale improved 11 points in an 80-point scale. They concluded that these results suggest that LymphaTouch treatment should be considered as an adjunct treatment, especially with persons who are not very responsive to traditional CDT methods. These 3 presentations were the example of the latest study results published. We have our clinical proof book available online where you can read the abstracts of these studies conducted with LymphaTouch, including these 3. The common conclusion of studies with LymphaTouch is that further studies are needed to show how LymphaTouch actually works in the different patient populations. We are working with several institutions internationally to get more data related to LymphaTouch treatments. We will receive information on how LymphaTouch works with lymphedema patients, post-operative cancer care, orthopedic and post-trauma patients, neuropathic pain and cancer treatments, and many others. We are eager to hear the results of these studies and will keep you updated in the future. There are a few things we hope that you keep in mind about our presentation. First of all, LymphaTouch is a versatile tool for manual treatments of cancer patients, and it can help the therapist to work more efficiently with lymphedema and swelling, scars, axillary web syndrome and fibrosis, in pain management and soft tissue restrictions. Also, if there are other patient populations and therapists working in your facility, LymphaTouch can be used outside of cancer rehabilitation as well, such as for orthopedic patients, musculoskeletal disorders, and neurological patients. LymphaTouch can really help to improve therapy outcomes, especially with the challenging cases by enhancing the lymphatic flow and mobilizing tissue. It efficiently can help in reducing swelling and pain and improving functional outcomes and quality of life of the patients. LymphaTouch provides device-assisted negative pressure and mechanical vibration, which cannot be performed with hands or any other equipment. It creates the third dimension to the treatment in a safe and controlled way, which makes a big difference when comparing, for example, to traditional cupping. Manual treatments can be hard work and cause some occupational aches and discomfort. LymphaTouch, as well as other instruments, can really help to save hands of the therapist in comfortable and safe way. There are also a lot of studies already conducted with LymphaTouch that show the improved outcomes in therapy and support the use of negative pressure as part of manual treatments. Additionally, there are a lot of ongoing projects in different patient populations and outcomes. Here is a small recap on how to apply LymphaTouch with different kind of techniques with cancer and lymphedema patients. We can activate lymph nodes with stationary technique, guide lymph towards healthy lymphatics with the sliding technique, combine different techniques to treat cords, fibrotic, and scar tissue. And remember, combination of treatments is usually the best way to achieve the best possible results with the patients. LymphaTouch cannot replace your hands. It needs the professional to guide the treatment and assess the tissue quality and the individual situation of every patient. There is a lot of information available online, so go and check the amazing stories, webinars by the patients and professionals using the LymphaTouch negative pressure treatment as part of their therapies. Also remember to follow us on the social media channels like Instagram, Facebook, LinkedIn to keep yourself updated of the latest news and information. If you have any questions or comments about this webinar or the product itself, you can always send email to contact@lymphatouch.com. See also our website for further information. Thank you for your time, and we look forward to hearing your feedback about the webinar. Stay safe and healthy, and thank you.